We're always working short-staffed. We have a backlog of over 2 years. We hardly have time to take breaks or go to the washroom. I don't think that patients are getting the care they need.
It's almost normal now to be short-staffed every day. It wasn't like this when I first started nursing. You can feel the stress when you get reports of the number of patients you're going to have that day. We're getting these complex patients. We have more and more responsibilities. My colleagues are crying. They're burnt out.
All of the healthcare workers we interviewed spoke about how they and their colleagues suffered from stress, from burnout, depression, and a sense of moral injury, that they're unable to do the job that they were trained for, to take care of patients because of the demands and the lack of respect that they receive at work. They felt exploited and disrespected.
And they told us that staffing shortages are becoming even more acute, and that such stressful working conditions have a profoundly negative effect on their own health, but also on their ability to take care of patients.
They've cut me up into pieces. They spread me so thin that I don't have the time to provide the level of care that I would love to provide. So, I just do what I can. That's where the pressure comes in, and the anxiety and the guilt and the feelings that I should have done more, but I can't. I can only do so much. And then with the issues that we have at work and the concern about patient neglect and the physical part of the job is so draining. My job is killing me.
Generally, largely female workers that are hospital workers where those results came from. And, it is a reflection about what is going on in hospitals across the province, where we're seeing a really deep crisis that is happening due to the fact that governments have been underfunding hospitals, and the workloads that these employees are facing since COVID has, exponentially increased over the past couple of years, and people are just had enough.
And you would think that faced with this kind of a staff shortage, which is only going to be made worse as the population grows and as it ages and demands more care, you'd think that they would create tens of thousands of new training spots. You'd think that they would offer inducements financially to people to stay at work, but they don't do any of that. And the consequence of that is that people are leaving in droves with no plan to replace them. And that's not sustainable. One of the best ways to address it is to step in with nurse-to-patient ratios that actually guarantee that workloads will be sufficiently staffed so that a person can deliver the care that a patient needs. If we can do that, then we don't go home feeling guilty. We don't cry in our cars at night after our shifts. We're not broken by the work over time. And the patients receive so much better care. So in other provinces like British Columbia, in other United States, California is an example, they have nurse-to-patient ratios, and they've had a significant impact both on lifting the morale of the workforce and the quality of patient care, but also halting this loss of healthcare workers out of the professions.
It's embarrassing to say I don't have the compassion that I used to have. I'm not at all the nurse I wanted to be. We all recognize that it's hard for patients too. This is not the kind of healthcare they deserve.
I loved going to work when I first started. Now, I dread it.